Hello and welcome to today's webinar. I'm Belinda Goodrich with Frost and Sullivan, and our webinar will begin in just a moment.
Hello, and thank you for joining us. It's my pleasure to welcome you to today's webinar, Healthcare Staff Wellbeing is the New Top Priority. I'm Daniel Rupar, Consulting Director at Frost & Sullivan, and I'll be your host today. Throughout today's discussions, you can submit your questions at any time and just utilize the Zoom Q&A option to submit them. We'll be also live tweeting during today's webinar. Follow a conversation on Twitter with the handle at @FS_events. And finally, today's program will also be available on demand, and you can find that by visiting frost.com/healthcare staff. And feel free to share the program and that link with your colleagues or other folks you feel may be interested. Now we're going to have everybody briefly introduce themselves before we begin the discussion. Perhaps Rosie, if you could start us off with that.
Great, thanks, Daniel. My name's Kapili Rose, and Rosie is fine. And I'm the Global Healthcare and Life Sciences Offering Leader for DXC Technologies SAP practice. And I've had a background in clinical and business systems throughout my career. I'm really excited to be here today.
Great, thanks. Lisa?
Hi, my name is Lisa Bellini. I'm the Senior Vice Dean for Academic Affairs at Penn Medicine and the University of Pennsylvania School of Medicine. I'm a practicing pulmonologist in addition, so I have some firsthand experience with what we're going to be talking about. And part of my portfolio specifically reflects the health and wellness challenges that we've been having over the course of the pandemic. So I'm thrilled to be here and learn from my colleagues today.
Great, thanks, Lisa. Tiffany?
Hi, Tiffany Lipscomb, Vice President of Human Resources for Intermountain Healthcare. I have been with Intermountain for almost 29 years, the entire time in human resources, and so I have seen the various changes in healthcare over the years and excited for this discussion.
Great, thanks. And Kaisa?
Hello, my name is Kaisa Winnicke. I am a director within Mayo Clinic overseeing our employee well-being efforts, which is in a holistic approach, expanding from the recognition of our staff all the way to the mental health needs and coordinating efforts on behalf of the institution to support our 73,000 staff that we have across the country. Glad to be here.
Great, thanks. And I'm glad to have all of you as well. Thanks very much, everybody. And now what I'm going to do is say a few words to kind of set the stage for what we're talking about here in today's session. So healthcare is, of course, facing a range of market trends and drivers altering the priorities, the needs, and the landscape for health services and solutions overall. And these, of course, include a mix of external factors, things broader in the market, internal issues and things organizations probably can more control or their approaches, and technology-oriented forces coming together to create that overall environment of unprecedented change. And some of the external things can include that overall market shift to more remote or virtual workforces, the influx of staff from outside local markets, as to try to help meet demands for the overall market. There's case volume changes coming from not only the challenges related to the pandemic, but the changes within approaches to how care is delivered overall, be it in-person, connected, remote, et cetera. There's a lot of aspects of those care model changes related to things like payment, reimbursement, greater consumerization in healthcare, or the expansion of non-hospital based site utilization in the continuum of care, including how you can best use the home. Internal includes organizational change factors, which can include things even like safety protocols, how workforces are brought in, what needs to be done for optimal retention, how mental health and wellness needs are optimally met, and what are some of those measurements that need to be looked at in order to measure and set goals for optimal performance management today, as well as moving forward. And finally, technology, that's of course progressing very rapidly. It's changing, it's things like how internal and external data to the organization can be optimally used for decision-making, how some of the innovations in analytics can change the game. What are some of those things that we need to do to break down IT silos as part of our enterprise strategy, or what solutions, applications, and systems are really necessary to optimally engage patients and our staff. And so if we go beyond that, when we think about overall provider workforce strategy, given what's going on in the market, there's of course a variety of interesting top of mind questions and imperatives to consider. And here's just a few of them which we felt are important and related to this session. How can we best optimize our workforce strategy for what we know, as well as best prepare for the unknowns, which can of course quickly alter demands on personnel as well as the organization? How should we actually best engage and support providers related to their daily work, or address the ever increasingly important point of conversations around mental health? What is that right approach for addressing and improving organizational workforce resilience in light of the challenges and changes that are going on now, as well as what will come? And finally, that ever important, what digital and IT investments need to be made in light of our organization's goals for workforce management strategy? And so that concludes my part of this event into presentation. And with that, let me say again, welcome to all our thought leaders. So now we're going to move to the first question for the group. What do you see as a top challenge today regarding workforce management for healthcare provider organizations? Whoever would like to go ahead and begin is fine.
I'll jump in.
Sure.
I think one of the top challenges right now and in the near future is helping our workforce process what I'm calling this COVID trauma. We've had, what was initially an acute, situation has now languished into a chronic situation. And that has different challenges for our teams. They're tired. They've seen more death and dying than they have in the past. And we're really focusing in on supporting them directly in their units with embedded counselors and peer-to-peer support. Just given the overall, kind of post-traumatic stress syndrome that we're seeing there.
Maybe I can follow up on Tiffany's point. I at least from what I've seen, our biggest challenge is that people are really languishing. And that's probably a problem right now that beats burnout, to tell you the truth. Languishing is this feeling of apathy and stagnation and just emptiness. And there was a recent article in the New York Times that really talked about this, I think, very well in a way that many people could resonate with. It's like looking at life through a foggy window, somewhere between depression and flourishing. But what is fact is that you're not functioning at your full capacity. And that is likely the issue that's going to affect us for the long term as we continue to stutter through this pandemic that will likely become endemic. And the Center for Mental Health Services has long outlined the emotional phases of what a pandemic looks like, its impact on the community. And you've got that pre-disaster planning phase that all of us were engaged in our respective organizations. And then we're all heroes. We come together, we get it done. There's tremendous community cohesion. And that's the honeymoon phase. But very quickly, you fall into this period of disillusionment where it's very difficult to keep up the energy and the commitment. And so this phase of disillusionment is usually marked by lots of triggers that we've all seen over the past 2 years, and Omicron only being the most recent variant. And it's really slowing our ability to recover. So how to deal with this languishing in the setting of a stuttering recovery of the pandemic is a challenge that hopefully this talk today and these panelists today will be able to shed some light on. I think that is our biggest challenge.
I would build from there. And Danielle, you summarized nicely at the beginning just the challenges and the evolution of healthcare that has been very rapid, that our healthcare workers are coping with in the midst of a pandemic. And so bringing to light all the staffing shortages, the high patient volumes, the more complex patients, I think really a big challenge is simply the retention of our staff and our workforce. Not only to our own organizations, but in the field of healthcare is something to really be focused on, and we are focused on. And then building off from what Lisa had shared, these cycles that she explained very well, is that getting to that phase of recovery has been such a challenge as we seem to go through some of those earlier stages, kind of in this cycle. So I think that's been very complex too, of not being able to get that full sense of recovery from the experiences that our frontline healthcare workers are experiencing.
Yeah, I don't have a lot to add there, Daniel, other than just this peak that we saw in the service demand has just continued. It's no longer a peak anymore. It's just this plateau of this severe impact on our workforce, which is causing the stress and burnout. And that's a really interesting topic, the languishing. And even in some of the work I've been doing with customers, I've been hearing about moral injury as well, which is this, what could I have done more? I've seen more patients, in one day than I have in my career with these significant, comorbidities, etc., and the fear and not having family there and that sort of thing. And there's this moral injury. And so the prevention of that and the support through that, there's a duty of care on organisations to actually provide their employees with some support in those areas. And yes, the staff shortages and this whole great resignation that we're seeing, people exiting not just their field but the industry. And that's scary. That's really scary. Some of the figures I've seen there is really sort of scary, but there are some challenges there for sure, Daniel.
Yeah, no, even you see that down to the individual. Like my family's lost multiple clinicians in terms of even ones that you would go see normally as part of primary care. I mean, it's all over the place in terms of those points of impact, definitely. All right, so now we're going to move on to, before we move to the next discussion question, we're going to move on to our first poll question for the audience. And so we're going to put that up and I'll read it here. So the question is your organization actively taking steps to promote peer support among employees and provide staff wellness resources? And there's a few different ways that you can answer that question. And if you could please take a few seconds to do that, we definitely appreciate it. All right, now we're going to move on to the next question for our panel. And that is there an approach you've seen which stands out in terms of how to best address provider workforce burnout and or mental health support? I don't know whomever wants to begin this one, maybe Lisa?
Sure, happy to start. One of the primary antidotes to burnout is engagement, and it doesn't take that much engagement to actually mitigate burnout. Whether or not engagement actually helps languishing is yet to be demonstrated, but it's a really interesting concept. About 20% of your time, if you're spending 20% of your time on something that you're passionate about, you're much less likely to be burnt out. And so whether that applies to this sort of period of disillusionment and languishing, we need to figure out, and I hope that we do. But creating opportunities for people to engage, not just the opportunities, which many of these panelists, probably all of us, have created these opportunities for people to engage, but we have to give people time to engage. And during this great resignation and the surge of patients, both inpatient and outpatient, what's really happened is this compression of time and compression of the workday to the point where you're working harder than you've ever worked. You're seeing more patients than you ever have seen. There's less and less time for you to actually participate in any of these activities that maybe we've rolled out from a system perspective. So how to meet people where they are in a way that they can consume what we're actually trying to give them so that it helps is a real challenge. And part of what digital solutions is clearly one of the strategies to do this in an asynchronous way so people can consume the material when they have time to consume it. But what's also going to be very important that we've really experimented with is defining what that mental health care support ladder looks like. It can't all be delivered by psychologists and psychiatrists and licensed clinical social workers. There are not enough of them. And so your first question about peer support and the use of individuals trained in psychological first aid to really help people with mild symptoms of distress is critically important. And to the extent that institutions aren't doing that at this phase of the pandemic, it's really important that they adopt some strategies to be able to support the workforce in that way.
Great points, Lisa. I don't know who else wants to chime in here.
Yeah, I can.
I'll go, Kaiser.
Thanks, Rosie. Yeah, the question is there an approach? It is a comprehensive approach. I think needs to be honoring that our employees are all in different places and in different experiences and in different states of well-being at this time. So how can we best support them? And so we've really taken this approach of, yes, the individual resources, the peer-to-peer support has also been key. So we've had a longstanding well-being champions program, but we've expanded to have a network of trained peer supporters who have the training that Lisa just spoke of with psychological first aid and being able to normalize the experiences and being able to guide conversations to a point where staff do feel supported and or can be referred accordingly. The balance of the digital and the human-centered approaches is key, I believe. And having staff, we've been leveraging our chaplains in spiritual care to provide work unit level support, checking in on our staff as they're checking in on the patients. And that is something too that is very intentional. We've seen a growing need for that level of care as well. And then finally, I would just elaborate on those work unit interventions, but also for our supervisors. That is a job. It is a role that we have seen increasing rates of burnout. In fact, some of the highest rates of burnout in our population is our leaders and our supervisors. So it's this balance of supporting them, but also the role that they play in supporting their colleagues. And so that's another approach that we've been really focused in on in terms of how do we sustain a culture where people can feel comfortable in reaching out, asking for help, and relying on each other.
Yeah, I'll agree with both Kaiser and Lisa there, Daniel. I think early in the pandemic, we did some research with end users, some design thinking with mental health professionals, nurses and doctors, and peer support was actually the top thing they were asking for then. And that was just as we were ramping up. But one thing I've noticed, and you've both touched on it, is, there are possibly several services or significant things on offer from various organisations or institutions, but it's being able to bring all that together and being where the employee is and actually getting to them. And we've actually done quite a bit of work to look at bringing that together as a portal or some sort of wellness entry point where all of the services an organisation offer are available to them. So whether or not it's a mindfulness program or a support group or some other thing, just to have something to bring it all together, because some organisations find it's a bit disparate and people don't know where to get that data and that type of thing.
The only thing that I would add, I would agree with everything that has been said here and some wonderful ideas. As was mentioned, it really is a comprehensive approach, and it really needs to flex based on where each employee or caregiver, as Intermountain calls them, where they are. And that includes our caregivers' families as well.
Yeah.
This is watching out for social determinants of health, food insecurity, housing insecurity, as well as their supporting their mental health. We have embedded counselors in all of our trauma facilities so that they can build those relationships and help support each other. We also have the peer support as well, but then really try to just layer on anything that can help and extend a lot of grace and gratitude to our caregivers during this time, as well as their families, are the things that we're focusing on.
Yeah, thanks very much, Tiffany. Yeah, and thanks everyone for sharing your thoughts on that. Was really interesting. Some of the stuff that you all were reflecting on, definitely. All right, so now we're going to move to another poll question for the audience that'll be put up for everyone. So this one is, due to the global pandemic, is your organization investing or planning to invest into human resource technology? And there's a few different answers for you, and I'll just give you a few seconds to do that. All right, so now we're going to move on to our third question. And this one is, how are workforce strategies changing in terms of the use of IT or other digital tools centric to talent management, things like performance, learning, or recruitment, as well as the employee experience? Perhaps, Rosie, if you'd like to start us off with this one.
Sure, and this one I can talk on for ages, so I'll try and be as succinct as possible. But what we're seeing is definitely there's an ease in workforce management processes when a competency-based view is taken. So actually understanding the talent pool, skills and competencies, where those gaps are, being able to mentor and fill those gaps with learning on the job, role-specific training, or even training around mindfulness and those things, but understanding where your staff are and what the competencies are allows you to actually assign them when there's a peak in service demand. Whether it's this type of service demand or something more local, you can actually have a view. We actually found some of our customers had the certifications of their employees hard copy, photocopied in HR files in filing cabinets, which didn't give them readily available information on the competencies and skills of their workforce and the ability to assign them. And it's about using them more wisely. So I guess it's this work smarter, not harder sort of analogy. And actually seeing what can we do with the other skills and competencies. Some organisations are using EMTs and putting them into some of the more lower level clinical roles so that their nurses can actually do more higher and more important clinical tasks, but the patient still gets the same amount of care. But it's about understanding the skills and competencies of the people and assigning them to the roles. And it's, I think, this holistic view as well. So you mentioned employee experience. I think that's really important. But care team wellbeing and engaging with your employees is really important. And technology can support there as well. So anything that supports during times of stress, keeps the employees engaged, and gives the organisation a view of those employees and how they can be used to the best of their capability would really, really benefit both the organisation and the staff and the patients ultimately.
Right, definitely.
I might just follow up on Rosie's comments that, you know, the professional development component is so important. And as organizations have moved to this competency-based model and really trying to build out competencies for each level in the organization, for each role, managing that at the level of the manager, I mean, at least what we're experiencing is managers themselves haven't necessarily been taught how to manage effectively, particularly performance evaluations for these competency-based performance reviews that they need to conduct. And part of it is the sheer volume. A nurse manager in many of our organizations could have 120 employees that they work with on a single unit. And so how, you know, to Rosie's point, this has got to be digital at this point. We should be able to collect, collate, and present managers with information that is actionable, that is easy for them to use, and conduct reviews in a way that's meaningful to the employee so they feel like they're actually being developed. So I think these kinds of tools are really critical. And if we're going to retain our workforce and develop them, we're going to have to invest in this because they want to be developed.
Indeed.
I think in addition to that is the recognition that with kind of the talent war, the labor shortage, we are all having to grow our own workforce. And that means bringing people in, what we call our outside in and our inside up strategy, where we bring people from the outside in and then support them with educational opportunities, certification opportunities. We use the tools that Rosie mentioned as a way to support and have our caregivers see the career pathway, and then provide easy tools where they can then access that and feel that professional development that Lisa was mentioning.
Great, thanks. Tiffany, Kaiser, do you have anything to add?
They represented that question very well. So thanks, team.
No problem. All right, so let me move to the next poll question, which is, has your organization made business or technology changes to ensure your org is better prepared for future peaks in service demand? And there's 4 different options for you to choose, and we'll just give you a few seconds to fill that out. All right, so now we're going to move on to the 4th and final question for today's session, which is kind of looking forward in terms of everything we've been talking about. So what most excites you about the future of workforce management and staff well-being? I don't know who wants to go ahead and start us off here.
Yeah, I can. Yeah, absolutely. Yeah. So I think one of the terms I would elevate or just bring to people's attention is this concept of post-traumatic growth, and really looking at and elevating the growth that our teams have experienced and how we've adapted as a healthcare organizations, as a healthcare staff, how we've been resilient through these times of change. And I think it does take some intentional efforts to highlight that and to bring that to people's attention and to understand that there's significant opportunity to build upon what we've learned and what we've endured over the past several months, now going into years. So I think that is something just to really honor and celebrate, and we have opportunity for. The other aspect that I get excited about too is just this demonstrated ability for agility within the workforce. We've had a significant efforts of shifting staff that are more in administrative roles into helping in frontline patient care roles, whether it's working in vaccine clinics or working in COVID testing sites or helping in the ED for support of our patients and their families that are waiting. And I think it touches on, in some ways, that agility has not only demonstrated the agility of the workforce, but also brought those opportunities of meaning in people's work, similar to what Lisa talked about earlier, by bringing that personal connection for some of our administrative staff who may not be as closely tied to the patients. And I think that's an opportunity in an area that just inspires me to see how people have shifted to fulfill the mission of our healthcare organization.
I would add that this has been an incredible period of innovation, and that is really exciting to see. People in the roles that we have had the opportunity to work with the tech side, with the behavioral health side, with the IT side, all to try and rapidly come up with solutions to improve the provider experience and the patient experience. And honestly, outside of a pandemic, I would say the progress that we made would have taken many more years than just 2. And so the innovative component of this is just extraordinary to watch. And I think the last thing I'll say is we need to understand what actually works. It's really important that we understand what leads to retention. Good retention. Retention's never going to be 100%, but what's the acceptable number that an organization is willing to accept? And then how do we measure success with retention and burnout? And those, the Mayo Clinic has led the way for a long time in thinking about assessment of burnout and wellness. But we really need to understand what works, especially given the compression that you mentioned before on cases and rates and lots of other financial pressures that even successful organizations are having. A strategic approach to what truly is an intervention that is measurable and makes a difference will be very important going forward.
Great, thanks, Lisa. I love the points around the incredible period of innovation. I often wonder, how long would it have taken for us to, let's say we are at a certain outcome level, and we did that within 2 years on some of these things. Is it more like that would have taken like a decade, or does there need to be some event like this in order to push that innovation in the right direction, do you think?
We've seen here in Australia, I'm based in Australia, and we've seen some innovation in our health system from a digital perspective that I know just through my work has been 8 years in the planning and the running, and it was implemented in 6 months.
Yeah.
So electronic prescribing was one of them, things like that where you just go, wow. It unfortunately took this massive impact to do it, but it moved it along so quickly and it was successful. It works. So yes, it failed to plan and plan to fail type, analogies that are always sort of spoken about in delivery, but to actually have, I guess, be up against the wall and to be forced to do something like this. It's possible. It is possible. So sometimes it's going out on a limb and taking a bit of a risk as an organisation to get it through, but it is working. And I think we had, the means to do it. We were just sort of stepping through it in a more sequential process where this was just all getting it through together. But I think some, really exciting things from a technology perspective, but also from a human, individual and organisational perspective is how prepared we are for the unknown now. And that, it is about being prepared for if it happens again, but it's not another pandemic. It could be any global incident or a significant accident or a natural disaster. It was only recently we had a volcano under the ocean that ended up, an island in trouble. So you can think of the peak in service demand that could come from anything, but we are more prepared. If we can retain those staff and look after those staff and make them as important as patients. So we've spent years looking at patient experience and, X and O data and that type of thing. And let's really focus that now on the employees. And I think that's part of the quadruple aim. We've looked at, patient experience and keeping costs down and increasing the health of the population. But we've now, evidenced that actually looking after the care team and that care team wellbeing is imperative to delivering on all of those other aims. So I think that's what's exciting, is we've actually validated some of these principles and can move forward with that sort of resilience.
Mm-hmm. No, thanks very much, Rosie. Tiffany?
Yeah, I would just add to these wonderful answers that as Rosie was talking about, what we call a caregiver-centric focus, which is really bringing that into a full relationship. I think healthcare traditionally has been quite rigid in their culture in terms of their shifts and in the way we managed teams. And this has really required us to become much more flexible and really meet people where they are, understanding their whole complexity as a human being, and how do we now match the needs of the organization with the needs of the caregivers and really make that a full relationship. So taking care of our caregivers who take care of the patients is our goal.
Okay, great. Thanks very much, everybody, for sharing your insights on as part of our initial discussion. And right now, we're going to spend a few minutes answering some questions from our audience.
Thank you so much, Daniel. Welcome back to our Q&A session. We have some great questions that have come in that I will tee up to this amazing panel. Incredible discussion again. Thank you so much for the contributions. First question that I'm going to put out to you all. You mentioned staff burnout. How can we tell how burned out the staff are?
Yeah, I'm happy to go first here. I pointed to this in my later comments in the panel discussion. We have to measure it. You have to measure it if you want to know what it is. And there are validated tools out there. Again, Mayo leads the way here. They've done a lot of the work in publishing the instruments, and they've become very simple, the instruments. You can accomplish this with 2 questions that have been validated for use in many populations. And so we have to be able to measure it to actually do the surveillance. And then we need Rosie's back end. We need to be able to collect the data and create dashboards of the information so that people who need the information can actually access the information. And that would be managers who are trying to keep an eye on what's going on with their staff. It could be the chief nursing executive or the CEO of a given hospital or unit. But we have to create, if we're going to collect the data, we have to do something with the data. And we have to make it easy for the people who are consuming and using the data to really use it and create change. So personally, I think we have to be able to measure it. There are tools out there, but people get stuck with the implementation of those tools, how to collect, collate, and present it in a way that's actionable.
Yeah, I would just echo some of the things Lisa said in terms of having it be very easy, because of course, when you're measuring burnout on individuals who are have increased rates of burnout, you don't want to add burden to that experience. And so certainly there's validated tools that can be summarized in the 2 questions that can be utilized within the organization or at a department level or within the work unit level. Lisa mentioned about the Mayo Clinic Wellbeing Index. There too, it's more for the individual to assess where they're at and be able to make some comparisons to others in similar professions as themselves at other healthcare organizations, but also understand which tools and resources are available to them. So I think leveraging that opportunity of measure to also be in kind of the initiation of taking action at the individual level, but also at that organizational level is important.
Oh, go Tiffany. You go.
Okay, just adding that, paying attention to both the anecdotal as well as the statistical focus or the data focus that can guide you and see where you have trends, where you may have individuals, but as well as overall global trends, and then turn them into action plans. So similar to others, and it's a very important question. Go ahead, Rosie.
I was just going to say there's certainly tools and measures for burnout, and there's inventory measures and there's academic measures that are built into various tools. But my only other point there was employee engagement we spoke about just before. That's another indicator. Sort of if that engagement level is dropping, it may be a sign that, you know, there's a level of burnout creeping in. And so that's when it may be a trigger to look at some of those tools. But measuring employee engagement is key too.
Excellent, excellent. All right, we've got another one here. How would new systems stop staff shortages? How would new systems stop staff shortages?
So the big question, isn't it? I think it contributes to retention. We spoke about retention earlier. Having systems in place, and it's not just technology systems, there's business processes as well as the solution processes that support it. But if you can engage your workforce, if you are assisting them in their development, Lisa mentioned earlier how important that was, and if you can support the organisation and the individual resilience and the individuals and then a whole as the organisation, you will be an employer of choice, you will stop some of that turnover, you may attract new resources and therefore reduce the staff shortages. Now, there are the global great resignation and there is this global staff shortage in so many industries, technology industry, healthcare industry and others. But I think it's about making the employment a place to want to be, I guess. That's my sort of thoughts on that.
Anyone else like to add anything on to that?
Well said. Just using technology to be as predictive as possible so that you can anticipate what is coming up, understanding factors that are happening in the community, in the globally even, and then bringing that into your workforce plan to be predictive and anticipatory. And then marrying that with the exact staffing plans so that you understand how many do you need to recruit, how many will you need to grow your own, and use the educational opportunities to help support growth into areas that you will need. So there's a short and a long game there, but it's important to anticipate.
All right, we have another one that has come in here. Dr. Lisa, Tiffany, often technology is seen as a burden on the caregiver experience. Each of your organizations has balanced innovation versus workflow that impacts that experience. Are there examples of a gold standard in other industries that you would like to see in healthcare? Great question.
That is a great question. I guess I would say, I'm going to turf it to Rosie really quickly. I guess I would say that if healthcare becomes so automated that we lose the personal touch that patient care actually provides, we've gone in the wrong direction. I think part of our great resignation is actually the difficulty that clinicians have had in establishing meaningful relationships with patients, because now we're wearing masks and gowns and hoods and talking to people through iPads and telehealth. And that's not why we became clinicians. And so I think there's a real challenge there in maintaining the human connection. So we're never going to automate medicine to the point where it just sort of goes along an assembly line. It just doesn't work that way. And that's not the workforce that we're going to try to attract. But I do think we can take some lessons from other organizations and other types of industries so that we can optimize the experience, both for the clinician and for the patient.
What we've tried to do as an organization is understand where technology actually enhances the experience, and then where we need high touch, and high touch enhances that experience, and try to leverage technology to support both so that we can enhance the consumer experience for caregivers, as well as provide that personalized touch when necessary and when it is supportive of the high level of experience they deserve.
Tying it back to, Oh, I was just going to tie it back to the one of the previous questions too about the measures. When we look at burnout, there is a component of depersonalization. When we look at overall well-being, there's a component of meaning and work. So I appreciate this question in terms of how can you leverage tools in a way that it reduces the burden, reduces some of the burnout that our providers might be are experiencing, but in a way that it doesn't take away from that meaning and work or bring forth depersonalization. So just appreciate some of the comments already made here today.
The only thing I'll add is that we mentioned earlier about making the employee as important as the patient. And I think that's, yes, historically through clinical and business systems in healthcare, there has been a burden on the caregiver experience. I've got all this admin to do now. I've got to stand here and put all my notes in, and it's changed their workflow where they used to maybe dictate something and it used to be typed up and the report was sent off. Now they actually have to do it themselves. But I don't think there has been a lot of focus on those caregivers as what can we do for them. It was very much focused on the patient outcomes. It was very much focused on getting clinical data, front-end patient-facing systems, diagnostic systems, all very good systems, but it did create that burden, and the person asking the questions acknowledging that. So I think just focusing on the employee now and focusing on the caregiver is maybe something that will be a change. And we have started to see it in process improvement in healthcare, but I think it's the gold standard isn't so much what another industry would be doing, but what can we do in this industry that maybe puts the employee and the caregiver at the same level of importance and focus as a patient.
Excellent. All right, this one is excellent. Tough question that just came in, but you all are up to the task, I'm sure. How do we best make the programs designed to combat burnout and show employee appreciation more available with the staff shortages in several departments?
That is a great question, and it's a question we grappled with throughout the pandemic, and to be honest, even previous moments of staff shortages, where we were trying to understand, okay, we hear and we see and we know that our caregivers are getting burned out. Let's do an event recognition, but yet we couldn't find a way to give them the time to support them in that. And so as we looked at that, we really tried to come at it from all angles and really work with their leaders to ensure that leaders were providing opportunities and working with caregivers to find that time. We asked our leaders to be checking in regularly on caregiver mental well-being so that if we could identify quickly that there was somebody truly struggling, that we could find a way to help relieve them of responsibility so that they could attend to themselves. When there were times where we couldn't support rotating people off as much as we would like, we tried to make their life as easy as possible and provided meals and take-home meals for their family, groceries for their family, to just make it one less stop that they had on the way home. So we really tried to bring that around full circle. We tried to provide EAP opportunities via video so that they could, move into a room and have a conversation with our EAP or other counselors. So just tried to look at it from their perspective and think about how we could enhance their experience in any way during this difficult time.
I can give and just elaborate a little bit on my earlier comments about how we've been partnering with our chaplains within spiritual care as part of their interactions with our staff. They are bringing in tools and food and items to support respite and just time away right within the work unit. And that has been well received because it provides that point of connection. It shows that visible support and appreciation, but also helps to meet some of those basic needs of just taking a break in the day and getting some type of a snack or some type of replenishment in the 12-hour work days. The other element is also working with some of our leaders who are doing, as they're doing rounding, they're bringing what has become known as the joy cart. We didn't call it that to begin with, but just bringing around snacks and food, and coming from a wellness background, candy, to our employees. But it is that we've been intentional to engage our ops administrators and leaders in partaking in that, because it also creates that appreciation, but also that opportunity to listen and hear from employees too, of what they're seeking and what they're needing as well. So yeah, bring it to them.
I guess the last thing I'd offer, I agree with everything that's been said, is sometimes the staffing levels are just so critical that you can't engage in the moment in these great opportunities. But at least the stress on the unit, the employee needs to be acknowledged. And so acknowledging what's actually going on in real time, and then setting up the opportunity to address, again, in 2 weeks or in a month, we're going to do X, Y, or Z, but people need to be heard and the issues need to be recognized. So even if you can't necessarily address the problem in real time, let people know that you care, and you will be planning something as soon as this sort of acute phase is over. Sometimes that's the best you can do, but doing nothing, I think, is an anti-engagement, creates an anti-engagement sentiment.
Excellent. All right. We've got time for another one here. Let's see. Does my employer need to change our current HR systems for these technologies to support employees? Does my employer need to change our current HR systems?
I'll jump in there, Belinda. I think it depends on the processes that they're wanting to support, but I know from being able to put some effective change in place can be done with current systems. So we've got solutions, of course, that would actually take a feed from a current HR or payroll solution and still provide some of these things, employee engagement elements, competency management elements, learning, that type of thing. So it depends on what's in place. But there's certainly options for organisations to enhance what they have without having to do a great big digital transformation and say, well, I need to start from the beginning. And it's a big 3-year project. There are some fast time to value solutions, and in that employee engagement and that sort of looking after the health and mental well-being of an employee as well, there are apps and various other solutions. So I think there's things that can be done without making a massive big HR solution change. But there are also needs, of course, to sometimes enhance some of those HR solutions. So it's a bit of a case by case.
All right, last question here that we're going to do. What business processes did you change during COVID that were successful and will continue to be used even after this pandemic?
I can jump in, and I gave in some of my earlier comments just about this agility and the adoption of agile practices. That is something that we've seen the value and is becoming more kind of mainstream, if you will, within our work areas. I think also the just internally, again, with the business processes, is just that focus on simplification and where can we reduce burden and what is value add versus kind of nice to have elements. I've seen that definitely come to fruition more through the pandemic and see that continuing on.
I would add.
Go ahead, Tiffany.
Okay, sorry, Lisa. I would just add to that, all that Kaisa said, but we've really leaned into our virtual work, and that we intend to continue to do so. We call it flex work. And how do we fully support our caregivers as they work remotely? Some teams may be a hybrid, some may be remote, but really doubling down on that technology of working remotely. Lisa?
It's exactly what I was going to say, essentially. You know, a full-time clinical role used to be 100% on site, and you were just here every day if you happen to be on call or work the night shift, whatever. But that is definitely not the case now, and you can do clinical work from a lot of different places. And so how do we embrace that while still maintaining a sense of community that promotes engagement, because 100% remote work is pretty isolating. And so where's the balance? And I think a lot of places are trying to figure out what that balance is so they can really maintain that sense of community and why you want to work at a particular place versus people's need for more flexibility, particularly caregivers, personal caregivers that have either young children or older dependent adults that they need to take care of. It's gotten pretty tricky for them too. And so how do you navigate that? That's a whole new burgeoning world of human resources and will challenge some policy issues for some employers.
All right. Well, I want to thank our panelists so much for their fantastic insights today. As we close our discussion, I want to acknowledge DXC Technology and SAP, who are a big part of today's webinar, and they'd like to hear from you. And they are offering to keep the conversation going, which I would definitely encourage. This is an important conversation for us to have. I'm going to go ahead and put up a poll here with some different options of where you can keep in contact with them, continue that conversation, and they've got some offers there for you. So I'll put that poll up. Again, I do want to thank our amazing panelists today. This is such an important topic, and I appreciate all of the insights that were shared. A couple of reminders as you're going through and answering that poll. We will have this webinar available on demand. So that will be posted shortly. It's going to be available at frost.com/healthcare staff, all one word. And so that will be available on demand. We would encourage you to share this with your teams, with your organizations, with other providers out there, because there was just a tremendous amount of value provided today from this panel of experts. Any last closing thoughts, ladies?
I love the fact that we're all ladies. How about that?
I think that's great too.
Yeah, I just think it's been really productive just to hear some of the real, on the ground processes that are being improved and the improvement that we can do from an industry perspective in the region. I think it's really great to hear.
Yeah, and thank you, Belinda and the team at Frost for bringing this as a topic of discussion today.
Absolutely, my honor and pleasure.
Absolutely, really enjoyed it. It's an exciting time to be in human resources and explore and innovate, and appreciate the opportunity to be here.
Excellent. Well, thank you all very much. Please stay safe, stay healthy, have a wonderful 2022, and let's continue these discussions. All right, bye all.